Hello everybody, Fertility Journals here. I noticed I got a bunch of new subscribers. If you're new, thank you so much for watching. If you have not yet done so, I suggest subscribing to my channel. I started this YouTube channel as a way to share my infertility journey because when I was going through it, I did 12 IVF cycles and I did IVF for almost 2 years and prior treatments as well. But when I was going through it, I really relied heavily on YouTube and research to be able to carry me through. So I hope that my channel will be able to give you some hope, some motivation, and an insight that could also help your journey. And if you are new to infertility, I hope that this information will be helpful and save you a whole lot as you learn from me and others. Thank you for watching. Today, we're gonna talk about embryo banking. I do this Q&A videos whenever a lot of people ask me the same type of questions, and I figured I'd hop on here because maybe it's something that people want to know. If you would like to ask me a question related to infertility in the hopes that I can share a perspective just based out of experience, please go ahead and send me an email. I am more than happy to be able to answer the question for you. And so I will get right into it. So what is embryo banking? Embryo banking is, I would say, for lack of a better word, a method that you use as you undergo IVF treatment that allows you to take your time to bank embryos for the purpose of storing them for future use. Now, who uses embryo banking? I have heard of embryo banking predominantly being used by individuals undergoing infertility who are much younger. The reason I believe that is because in order for you to bank embryos, you do have to have valid eggs. You know, your doctors are not going to let you go through this process if your eggs are not viable, right? So a lot of younger people who want to preserve their fertility for various reasons embryo bank. I know cancer patients and individuals who are undergoing health concerns before they undergo the invasive treatment. The doctor recommends that they preserve their fertility that way for future use. And so that's how I came across embryo banking, and a lot of fertility clinics offer it. Reproductive endocrinologists specialize in it. And in a minute here, I'm actually going to share with you why we decided to embryo bank despite having age-related infertility. So in a nutshell, if you were new, age-related infertility, which is the diagnosis that we had, means that I waited a little too long. I waited actually too long to have children. And so women are born, actually not born, when we are conceived, that's all the eggs we have from conception. And so over time, your eggs get really old. So basically right now I have 45-year-old eggs. And so you can imagine, for lack of a better word, the wear and tear. And so that's one of the reasons why IVF does not work. The conventional IVF does not work when you have age-related infertility, and why many reproductive endocrinologists recommend donor egg. And so this is one of the reasons, if you've noticed, why it is not recommended for women in our age group. But how it can benefit you is that some of us going through this infertility journey because of age-related infertility, diminished ovarian reserve, low MH, we are poor responders. We decide to go through this because we are willing to do the work and bank the embryos in the hopes that at least one of them will be the golden egg. And so that was what it was in our case. So during our IVF journey, my husband and I incorporated this method. It was actually based out of research that I did with Dr. Saul Silber in Missouri. He does mini IVF. His mini IVF is actually Danish mini IVF, and you can look him up on YouTube. He's absolutely amazing. And I also was able to get more information on embryo banking from Dr. Jeffrey Scher of a clinic in Las Vegas, or the Scher Fertility Clinic. And he has webinars on YouTube, and he does talk a little bit about embryo banking. So the way that it worked for us is that we went through an egg retrieval process. And if the egg retrieval process was successful, yes, I say successful because there were some egg retrievals we underwent that had no eggs. Okay, I digress. So when the egg retrieval process is successful, then they match it with my husband's little guys to form an embryo. And when that embryo is formed, we let it grow up until the 5th day, where it got 100 plus cells. And then when it got to the 5th day with the cells, they would take a piece of it, and they would send it for genetic testing, or PGT-A testing, because women of my age group, we experience a high level of miscarriage. And sometimes this miscarriages lead to DNC, dilation curettage, which is a surgery that is done to scrape the remains of the fetus if it develops, if it's along the way. There's a certain period of time where the miscarriage cannot just happen naturally. So we did not want to risk that. And so, we would take the sample for PGT-A testing. Now, as a result of doing that, then the embryo has to be frozen, right? Because you're not essentially going to do a fresh transfer that cycle. So instead of us freezing the embryo and then doing a transfer the next cycle or the next time, however you'd like to frame it, we would freeze it, and then we would undergo another egg retrieval. And so my husband and I did back-to-back mini IVF egg retrievals in the premise of banking as many embryos as we could. This method does require patience. This method is really, really useful if you're trying to bank or trying to implant more than one embryo. Maybe you want to increase your odds and increase your chances. And it's really good if you're trying to preserve your fertility due to age, because I was never going to get any younger than I was when I started IVF. I mean, I started IVF, a lot of people would consider that late. I actually, at 41, going into 42. And so I was never going to get any younger. So instead of kind of getting an embryo and then, rushing through and transferring it at the next cycle, I decided to embryo bank, one, to increase my chances. More likely than not for us, it was to increase our chances, because it's very hard to get to the golden egg. And so the likelihood of us having more than one genetically normal embryo to transfer is very, very low, unlike other couples who are going through it for other reasons, like they have illnesses, or they're trying to preserve their fertility and they're much younger and they're undergoing some type of procedure, and vice versa. And so folks, in a nutshell, that is embryo banking. Thank you so much for watching. Until my next video, bye.